So, in this Chapter 8 Lab Notes Part 2, we're going to continue our look into the axial skeleton by looking at the facial bones. Just a quick reminder that the axial skeleton is composed of the skull, which includes the cranial and facial bones, the vertebral column, and the thoracic cage. And again, just a quick refresher about the axial skeleton. This is highlighted in that sea green. Now the gray structures, which we see over here and through here, those are all appendicular skeletal bones. When we're looking at the facial bones, you will see that most of them are paired, but there are a few that are singular. The vomer and the mandible are considered single facial bones. And this is just a quick overview of most of the facial bones are marked on this particular slide. On this particular view, we can see that there is a right and a left nasal bone, which makes up the superior portion of your nose before the little bump that most people characteristically have. This is going to be a close-up, and you can see a much better view of the nasal bones, both the right and the left-hand side. The next bone we're going to look at is the zygomatic bone. There's three landmarks you need to know: the temporal process, the frontal process, and the maxillary process. These processes are named after the bones that this particular bone will knit with. So for instance, the temporal process will touch up against the temporal bone, the frontal process will touch up against the frontal bone, and the maxillary process here will touch up against the maxillary bone. So here's a quick look at the zygomatic bone as it sits from a lateral view, an inferior view, and an A to P or anterior view. Now this is the view that you have in your Atlas of Anatomy Images book, and it's a little off in terms of how it is actually supposed to be aligned, but just to label it in the book, this is how you would label the maxillary process of the zygomatic bone, the frontal process of the zygomatic bone, and the temporal process of the zygomatic bone. In its proper orientation, the correct anatomical position, this would be how we would label it. So you would just basically take your book and flip it up so that it would approximate this orientation, and that's how it would actually fit on the human skull in the upright anatomical position. So we see the zygomatic bone shown here, and I'm going to just do a little border around the edges of where it's knitting in with the other bones. And we can see this one is a little bit hard to see over here, so I think it's right around there on that particular edge. And so this is actually what makes the apple of your cheek. So ladies, where you might put a little bit of blush, that's what we consider the cheek, if you will. Now the zygomatic arch is referred to many times as the cheekbone. And so when somebody has a fractured cheekbone, this is one of the areas that might be involved with that. And just another view to show you the zygomatic arch, which is made up of both the temporal and the zygomatic bone. Now the lacrimal bone, when we're looking straight A to P, it's a little bit hard to see, but it's on the medial side of the eye orbit. We're going to show you a different view that will hopefully be helpful. Again, when you're looking at it in the A to P view, it's just barely peeking out over here. So if we turn the skull laterally, we can see that the lacrimal bone would be in this general vicinity here. Now this skull, since it's a white colored skull, doesn't show us our articulations or sutures where the lacrimal bone fits in with the surrounding bones. So I'm going to show you it on the colored skull to give you a little bit better idea. On this view, because the skull is colorized, it's much easier to see where the lacrimal bone is found. And so that's this little orange structure that we see right through there. Now the vomer, we said before, is a single bone, so we don't have more than one, we just have one, and we can see it in different views. The easiest view is straight up into the nasal cavity on this A to P view. The next view that we see is on the mid-sagittal view, where the vomer is seen on its entirety from the side, and then we could also see it right here on the underneath view, the inferior view. So what I'm going to do is show you some different views of the vomer. So again, as we look into the nasal cavity, we see that the vomer is a centerline structure, and that's what makes up the inferior nasal septum. If we look on the inferior view, we can see part of the beginning of the vomer peeking out from the posterior aspect. And then again, on the mid-sagittal view, the inferior aspect of the nasal septum, right here that's being outlined, is the vomer. And it will articulate with this bone right here, which is the ethmoid bone. And this particular area is the perpendicular plate of the ethmoid bone. And just a close-up so that we can see the vomer. And one more from the underside or the inferior view where we see the vomer. The inferior nasal concha is a bone that is found both on the right and left side of the nasal cavity. If we were referring to both concha, we would call them conchae. It would end with an E on the end in order to make it plural. So many times they are referred to in the plural, the inferior nasal conchae. So on this close-up view of the skull, we can see the nasal conchae, both right and left side inferior nasal conchae, peeking out on the inferior aspect of the nasal orbit, or cavity, I should say. This is bringing us back to some previous material that we covered. You can see a little bit about the ethmoid bone in the eye orbit, as well as the perpendicular plate of the ethmoid here in the nasal cavity, and that's what's going to articulate with the vomer to form the full nasal septum. And then the middle nasal conchae on the right and left side, again part of the ethmoid bone, are going to be superior to the inferior nasal conchae that we see situated right here. The conchae in general helps circulate and warm the air that we breathe in through our nose. And this is just a quick comparison of the superior, middle, and inferior nasal conchae. So let's revisit one more time. We have the perpendicular plate of the ethmoid bone, the middle nasal concha on the right and the left, and then we have the inferior nasal concha on the right and then the left, and the other centerline structure is the vomer. Now the next bone we need to look at is the palatine bone, which forms the horizontal plate, which is the posterior 1/3 of the roof of our mouth, the hard palate. The palatine bone is a little bit easier to see from the inferior view, so everything that is outlined in green here is the palatine bones. And again, this whole area is called the hard palate, so that's where we actually have bony palate found. This horizontal plate is the piece that shows on the inferior view. Again, on the inferior view we see the horizontal plate, and then the rest of the palatine bone would project superiorly. And just another quick view on the colored skull just to make it very apparent for you. This whole area here is going to be the horizontal plate of the palatine bone, which forms the posterior 1/3 of the hard palate. Next, we're going to look at the maxilla or the maxillary bone. There's just 4 things that we have to identify. Now, in general, we're going to look at the body. We'll also look at the infraorbital foramen, the alveolar processes, and the palatine process. In this highlighted view, we can see the full maxilla. Maxillae would be plural, so we have a right and left maxilla or maxillary bones, and we would see that this area right through here, the border where the teeth insert, that's going to be the maxillary alveolar processes. And then underneath you see that there's a little bit of a hole here, so they're showing like a little pipette or a little twizzle stick sticking into that hole, and that's going to allow for nerves as well as blood vessels to flow through. On this view you get a nice picture of the infraorbital foramens of the maxilla. For the lab exam, you'll need to denote whether it is right or left infraorbital foramen. From the lateral view, we can see the majority of the maxillary body, and again you can see the alveolar processes where the teeth will insert in. From the underside, this is going to be part of the hard palate. As such, this area that's outlined here will be called the palatine process of the maxillary bone. So we're looking at the lateral view of the maxillary bone, and we're seeing the alveolar processes again, where the teeth insert into the bones of the maxilla. One of the things you want to take note of is that as people start to lose bone density, sometimes the area where the tooth connects in the bone starts to loosen up, and therefore we lose teeth. So having good bone density will help hopefully maintain your teeth inside your jawline for a longer period of time. And this is just another view showing you the alveolar processes of the maxilla. So we see shown or pointed out one more time the infraorbital foramen, both right and left side, as well as the alveolar processes of the maxilla. Now the inferior aspect, again, we'll just repeat, the inferior aspect of the maxilla here is the hard palate, and as such it is called the palatine process. So the palatine process is going to make up the anterior 2/3 of the hard palate. Now sometimes people don't have a fusion along through here, and so that would be where people have a cleft defect. And just to revisit the entire hard palate, which is made up of both the palatine bone and the maxillary bones have the palatine process, which goes through this area here, and the palatine bone has the horizontal plate, which goes through there. And just to make it a little bit easier for you, we show it to you color-coded as well. Now, the next bone that we see is the mandible, and so the mandible has several different areas for us to locate, many of which are labeled on this particular view as well. If we're looking at the lateral view of the mandible, one of the first areas that we're going to look at is this area right here. That's the mandibular condyle. That condyle is what fits up into the temporal bone at the mandibular fossa, and so that is what makes your TMJ joint, your temporal mandibular joint. Then we have the mandibular notch, which ends into the coronoid process. Different areas of the mandible in general. This up and down area through here is called the ramus. Where the mandible turns is called the mandibular angle, right through there. And then we have the whole mandibular body. We'll look at these on individual slides as well. We also have on both right and left sides a little hole that you can see on this medial view, and that's called the mandibular foramen. That is different than this hole over here. This hole on the lateral view, more towards the chin, is called the mental foramen. And so this is a nice interesting view of the mandible because we have this cutout here which reveals the teeth as they're nestled deep into the bone. And you can see that as we lose bone density in this area or through here, that would allow these roots to be looser and this tooth to leave. So that would not be a great thing. So again, we're looking at the ramus of the mandible, then followed up by the angle of the mandible, and then into the body of the mandible here. And then we have this foramen on both right and left sides, which is called the mental foramen. On this view, it's not as easy to see, but you can see a little bit of a hole peeking out over there. And again, on the medial aspect of the mandible, both right and left sides, there's going to be the mandibular foramen. And so here we go, I've got a couple of things renamed for you. We have the coronoid process of the mandible, we have the mandibular notch, and we have the condylar process of the mandible. Now, another way that that can be called is the mandibular condyle. And again, the ramus of the mandible. Just adding in the body of the mandible. Where it turns right here, don't forget, is called the angle of the mandible or mandibular angle. And the mandible has alveolar processes as well. So we have alveolar processes of the maxillary bone and we have alveolar processes of the mandible bone. What you need to do on your lab exam is make sure you indicate which alveolar processes you're looking at, whether it's mandibular or maxillary. To leave that off will result in you getting a 0 for that answer. And again, just looking at this foramen, this whole over here is called the mandible foramen. Now this landmark here where the chin kind of juts out, where you have the little bit of like the Kirk Douglas chin, this area here on right and left side is called the mental protuberance. This is just another way to look at the body of the mandible. And again, these little jutting outs on both the right and left side of the chin, if you will, is called the mental protuberance. Just showing you the body one more time. We can also outline over here this little hole and this little hole over here peeking off to the side. Both of those are the right and left mental foramen. And here's the labeling just for you for spelling purposes. And we've got our mental protuberance. And just another view of the mandibular foramen, which is surrounded by the glowing black circle. And we'll revisit that mandibular foramen one more time. Again, it's on the medial aspect of the mandible. And this is just a quick little look at the bones of the skull as they are underneath. So we have the sphenoid in the purple, the ethmoid, the nasal conchae, inferior nasal conchae, the vomer, and the palatine bone. And then in front of that, or anterior and superior to that, we'll see the rest of the facial bones that we had spoken about earlier. Now we're going to move into sutures. We touched on those a little bit when we were talking about the cranial bones before, but now we're specifically going to talk about them. So we'll show each of the sutures that you'll be responsible for your lab exam. The coronal suture many times is also known as the frontal suture, especially in adults. In children or children under the age of 4, not so much, but we can use coronal or frontal for adults. The lambdoid or lambdoidal suture is going to be seen in the posterior aspect of the skull, and it's named because of the Greek lambda sign, which kind of represents like that. Okay? So on this lateral view here, you can see part of the coronal suture as it separates the frontal bone from the parietal bone. We can see a little bit on the edge over here as well on the A to P view. The best view to see it in, the most that you'll see the coronal suture in, is in that superior view. Again, it separates the frontal bone from right and left parietal bones. And here's another look at our coronal suture with the arrows pointing to it. Now, we had spoken before about the lambdoid or lambdoidal suture, and it makes that lambda kind of signage or representation. Now, on this particular lambdoidal suture, we have the presence of 3 what are called wormian or sutural bones. These bones here would actually up your bone count. So normally speaking, we have 206 bones of the human body. This individual would have 206, 7, 8, and 9 bones. So his bone count would be a little bit more higher, technically speaking. And the lambdoid suture will separate the right and left parietal bone from the occipital bones. Over here, you've got a good representation, just in case you want to recall this, but this occipital bone has a really nice EOP shown right here. And this is the lambdoid suture as we see on our skull models. And then again, just a quick little review, that's our external occipital protuberance right there. And this is just giving you a view of the lambdoid suture without the red, so you can see the squiggly lines a little bit more clearly. Now the last couple of sutures that we need to go over are the sagittal suture, the squamous suture or squamosal suture, and then we've already talked about sutural bones, but we'll revisit that. And we'll see that the sagittal suture will separate the right and the left parietal bones from each other, and it intersects with the lambdoidal suture. And on our skull model, you can see the sagittal suture as well as the coronal suture. Without the red lines, you can still see the sagittal and the coronal suture. And the lateral suture that we see shown here is the squamous suture. Now remember, that is formed by the temporal bone, the squamous portion of the temporal bone. So squamous means flat. And so this is the flat area of the temporal bone, and it's going to meet and create the squamous suture with the parietal bone. And here you see the suture represented by the red squiggly line. And again, just labeled so that you can write it down properly. And then the red squiggly line is removed so you can see the suture itself. So we're looking at sutural bones again, and we'll see there's one right here, here, and another one there. So this would raise the body count bone count from 206 to 209 for this individual. And don't forget that the other name for sutural bones is Wormian bones. So, just to recap, we covered the facial bones in this PowerPoint. We had 14 facial bones in total. We had 2 nasal, 2 zygomatic, 2 lacrimal, 1 vomer, 2 inferior nasal concha, singular, conchae, plural, 2 palatine bones, 2 maxilla, singular, or maxillae, plural, and 1 mandible. We also looked at sutures as well as sutural bones. So make sure you check out part 3 of the axial skeleton, where we will be covering the vertebral column as well as some associated bones.